Go.
Hi, I'm Audra Crane, and I'm going to be your PD nurse today. Now that your PD exit site has healed from surgery, you need to start taking care of it yourself at home. So we're going to go over all the steps you need to do to do that and keep it clean and free from infection. These are some of the products you'll be using to take care of it. The skin cleanser solution, the antibacterial gel or antibacterial soap and water, tape, sterile 2x2s, and antibiotic cream. So the first thing I like to do is go ahead and open my packages, keeping everything as clean as possible. This isn't a sterile procedure, but it should be a clean procedure. On my first 2x2, I'm going to apply the solution, which is a bleach solution, so you should be careful not to get that on your clothing. Small amount, about a pea size of the ointment or cream. Usually we go with the cream. It's safer for the catheter. And the third one would stay open because that's what we're going to use for our bandage. And as long as, for the first 6 months, you want to keep the area covered with a bandage because that's going to prevent any trauma to the site, which will also prevent infection. So I'm going to tear 4 pieces of tape and one longer piece, which is going to be used just to anchor your catheter to avoid pulling on the exit site. So the first thing I'm going to do is clean my hands with the hand sanitizer or soap and water. Not necessary to wear gloves for this procedure. Take my first 2x2 and clean around the site in a circular motion, starting at the inside and working your way out. Always dirty to clean. After you're done, you want to let that air dry for about 1 minute. Today we're going to show less than a minute just for time's sake. After it's completely dry, take your 2x2 and fold it on the 4 corners. Then you have a nice little area to put your cream on. Again, you put that in a circular motion around the exit site. After that, you're going to take your third 2x2, and there's two in a package. Take one and fold it in half. Place it underneath the tubing from your site, and the other one you'll place over the site. And it's a little easier when you're doing this on a real person. Now you're going to place the pieces of tape in a window pane fashion around the exit site. The reason for this is you want to be able to have some breathing room in there. You don't want to completely occlude the area because this would be more likely for infection if you didn't use the window pane method. So your 4 corners are covered. And again, this will be easier when you're doing it on yourself. Your last piece will be used to anchor your catheter against your skin, just to avoid any trauma. So you always want to keep your anchor in place. And this is all that's required to take care of your exit site at home to prevent infection and maintain your access for your dialysis. Thank you.